Assalamu alaikum. I'd like to thank my dear professors and my colleagues for this invitation. Today I'm gonna talk about new steps in the novel of cancer pancreas. هو الحقيقة أنا بشكر جدا دكتورة فاطمة على إن هي عدت جزء كبير من epidemiology and risk factors for pancreatic cancer. I will omit these slides. I will highlight only for the symptoms of pancreatic cancers and diabetes. احنا حابين بس نقول إن don't neglect your patients with the early onset and uncontrollable diabetes, because according to the National Cancer Institute in July 2021, they reported that one of 100 people developed a diagnosis with the diabetes will develop a pancreatic cancer within the next 3 years, and one of 6 people diagnosed with the pancreatic cancers had the risk of diabetes before. Types of pancreatic cancers. We know that pancreas has an exocrine component from which the pancreatic ductal adenocarcinoma develops, and the pancreatic neuroendocrine tumors that we face nowadays. Some genes are accused to develop pancreatic cancers, from which the KRAS, which is present in about 95% of the cases. Diagnosis of pancreatic cancer. We know that there are some lab works and some images, like the pancreatic protocol CT and endoscopic ultrasound EUS. واحنا هنا عندنا في جامعة أسيوط دكتور محمد عبد الغني expert في EUS، والحقيقة بيساعدنا كتير جدا في أخذ العينات من البانكرياتيك كانسر patients، وسهل حاجات كتيرة علينا الصراحة في النقطة دي. We go for the treatment of pancreatic cancer. First of all, I'd like to tell that pancreatic cancer cells has صراحة عندهم hard and tough environment because of the presence of a dense stromal tissue. This stroma may prevent the reach of blood supply for the vessels which develop hypoxia. This hypoxia is واحدة من الفاكتورز اللي بتسبب new vascularizations and regrowth of the pancreatic cancer cells. In addition, the highly metastasizing ability for those types of cancer cells. الحاجة التانية إن في limitations of therapeutic limitations بسبب وجود resistance اللي بتحصل للsystemic treatment بسبب stromal tissue. NCN guidelines version 2022 classified the pancreatic cancer into resectable, borderline, locally advanced, and metastatic pancreatic cancer. The resectability criteria definition, الحقيقة many societies define this, and I will take the NCN criteria. احنا considering the patient of this type of cancer is resectable when, according to the veins, there is no contact or less than 180 degrees contact between the cancer cells and the portal vein and supramesenteric vein. For the artery, the supramesenteric artery, common hepatic artery, and the celiac axis, no contact at all. For the treatment of pancreatic cancer, the resectable criteria or the category go for surgery, then followed by adjuvant treatment of the systemic treatment. But the potentially resectable patients, this including the borderline and locally advanced pancreatic cancer. الحقيقة هو كان في debates كتيرة for a long time about the new adjuvant or the starting of the systemic treatment before surgery. لكن لقيوا إن في advantages كتير. لقيوا إن بعض patients receiving the systemic treatment الحقيقة مش هيحصل ديلي كتير قبل إنهم يبتدوا السيستميك تريتمنت بسبب التحضير للعمليات فترة طويلة قبل العملية، فبيحصل ديلي فور بعض البيشنتس، واحنا زي ما احنا عارفين البنكرياتيك كانسر من الحاجات اللي هي poor prognosis. الحاجة التانية إن we assess the sensitivity of this type of cancer for the drug or the systemic treatment. الحاجة الثالثة إن بنقدر نعرف مين البيشنت اللي will benefit from this surgery. اما من disadvantages بيبقى للاسف طبعا the patient may lose his opportunity for the curative operation. الحاجة التانية ان بيبقى طبعا this requires preoperative biopsy and biliary decompression. Many trials conducted to approve the benefits of the new adjuvant treatment, like one of them is the PrEP 02 JSAB 05 new, trial, which approved that they randomized the patients into two arms. One of them, the patient will go for upfront surgery followed by systemic treatment. The other arm, the patients will start systemic treatment, then surgery, then followed by the adjuvant treatment. والحقيقة هنا الميديان overall survival ادانا superiority for the new adjuvant arm by about 10 months superior between them for the new adjuvant arm. Those are many trials, or the other trials conducted to approve this concept. Thus, there is a strong relation rationale to include the new adjuvant therapy for all stages of the pancreatic adenocarcinoma, including resectable, borderline resectable, and even the locally advanced disease. For the metastatic pancreatic cancer, هو الحقيقة ده depends on the performance status of the patient, comorbidities, and the previous treatment if it's present. So the patients with the good performance status will receive combined chemotherapy. Patients with the performance status 2 will receive single agent chemotherapy. Patients with advanced performance status will go for best supportive care. So what the future of pancreatic cancer? احنا هنا الحقيقة الفيوتشر كله nowadays depending on the molecular biology of the cancer. والpancreatic cancer عنده many of the molecular mutations, either immunogenic, DNA damage response, أو حتى rare genetic abnormalities اللي اكتشفوها دلوقتي, some of which دلوقتي بدأت تبقى druggable و approved by FDA, والباقي لسه still under trials. والtrials أو clinical trials nowadays go for the target therapy and even the immunotherapy. حتى localized therapies بدأ يبقى فيها الترايلز كتيرة to approve the effect of localized therapies like radiofrequency ablations, microwave, intra-arterial infusion chemotherapy, or the transcatheter arterial infusion using RenovoCath as a model, isolated upper abdominal perfusion. So to conclude my talk, due to hard environment of the pancreatic cancer, steps for screening awareness route started for early detection, creating therapeutic possibilities for patients with advanced pancreatic cancer will require deepening of our biological and molecular understanding of the disease, while improving the preclinical development and the clinical translation of promising treatments. By the way, November 17th is the World Pancreatic Cancer Day. Thank you.
Thank you, Dr. Asmaa, for this excellent presentation and the summary of management of pancreatic cancer.
Thank you, Dr.
وألف سلامة عليكي.
الله يسلم حضرتك.
وربنا يتم لك الشفاء إن شاء الله وشاكرين مجهودك.